My name's Kelly Weary, and May is Mental Health Awareness Month. So we wanted to spend some time talking about common things that are brought to us related to mental health. One of the main things that I talk to my patients about every day are sleep problems. It's one of those things that all of us have experienced at some point in our life, whether it be an infant at home or some stressful situation, but we can all understand that not sleeping well really impacts our overall health. And for those who have sustained problems with sleep, problems that last over a week or so, imagine how horrible we all feel when we don't sleep. So today I want to talk to you about some tips to help you sleep better. A little science on sleep. We know that sleep is a very complex part of our body. There's several neuronal pathways in our brain that are related to sleep and different mechanisms that either help us sleep well or impact us sleeping poorly. But my message is it's very complex. And as we look to sleep better, there are some things that we can do. One of the things is I ask you to make sleep a priority. Don't try to shortcut sleep. It is as important as any other bodily function that we have. So make sleep a priority. If you're having problems sleeping, keep track. Either use an app, use a watch or some kind of a device, some kind of sleep diary so that you have more data to review and plan. Make your bedroom or your sleep space a sanctuary, so to speak. Have comfortable blankets, try to get your temperature good, have it dark and quiet. One thing we all talk about is no television, no screens. Keep those away from your bedroom space. Try to set a time, about a half an hour to an hour before your bedtime to really relax and make this kind of a habit or a ritual, as we call it. Whether it be practice some meditation, some breath work. One of my favorites is a light yoga practice before you go to bed. But it's so important to have that getting ready to sleep time. And as we talk about time, try to have consistency. Go to bed at the same time, get up at the same time. Even on the weekends, it's hard, but try to keep that routine. And the best that you can, follow your natural pattern. Try to sync your life to what your body likes. So most of us have a time that's natural for us to get tired or natural for us to get up. And try to mimic that as much as possible. If you do go to bed and lay there for 20 minutes tossing and turning, research tells us to get up, do something that's quiet or relaxing. I often say sit in a dim light area and read for maybe 20 minutes and then try to go back to bed again. But sometimes when we stay in bed tossing and turning, it just doesn't work. So it's best to get up for a little while. One of the things that most of us Americans really struggle with is that caffeine. Don't underestimate the power of caffeine. So keep your caffeinated beverages to morning time, just 1 to 2 in the morning, and then limit it afternoon. It will impact your sleep for 10 to 12 hours after drinking a caffeinated beverage. Also, alcohol. Don't drink alcohol if you're working on your sleep. It makes your sleep more restless and interrupted. So take that out when you're concerned about sleep. Also, large meals. You want to avoid large meals. A light snack at bedtime might be helpful if you're hungry, but usually indigestion and things can happen. And also nicotine. Limit nicotine use about an hour before you go to bed. One of the things that many of us providers are going to talk about for overall wellness is exercise. So always try to increase your activity. There's a ton of research and data that shows the more active we are, the better we will sleep at night. And if all of those things don't really fix your sleep, keep doing them. They're important, but sometimes we can use some supplemental kind of things to help with sleep. things like melatonin, valerian, even lavender. But there are many things out there that might be supportive in your sleep cycle. If a person has a very severe sleep concern, it's time to pull in one of your medical professionals and talk. There are sleep specialists and things like sleep studies that can be done to rule out more serious sleep problems like narcolepsy or obstructive sleep apnea. But my message is there are tests and treatments for those if the sleep continues to be a concern for you. But most importantly, I just want us all to think about what a value sleep has in our overall health. And it's such a foundational part of our wellness. So please practice good sleep patterns and work to take care of you inside and out. Thanks so much. Have a good day.